Hello, everyone. Dr. Lisa Palmer, Dr. Mama Bear, coming to you live from Central Florida on mental health, mood disorders, and magnificent results. I've been asked a lot lately, what do you do in natural health care about mental health? What do you do with people that are stressed out? What do you do with people that are feeling anxious? They're feeling depressed. They're been labeled with a diagnosis that just kind of groups together some symptoms. What do you do with those cases? Well, there's some things that we look at in natural health care when it comes to mental health. We look at what physiologically happens to the body when somebody is under stress. So we do know that you have two parts of your nervous system. You have your autonomic nervous system. It comes from the word autonomous, meaning you don't have to think about it, right? And the two parts of that nervous system are your sympathetic nervous system, which deals with stress. Here, where I live in Central Florida, there's black bears. And so, say you go outside your door. The other day, we left the garage open and my dog starts barking, and we heard the garbage can get knocked over. Now, can you imagine if you went outside your house and went to turn the corner and ran into a black bear, right? Your nervous system that deals with stress would kick in, right? Your fight or your flight, right? So I recommend leaving if there's a bear, right? You definitely don't want to fight the bear. It may not be a great idea to run, but back away. And if you have one of those bear horns, those work really good. And so actually, my husband, we heard the bear. My dog notified us that the bear was there because he definitely alerts us if somebody's at our front door or if a bear is around. And my husband grabbed the bear horn, and that horn, it's a special horn. And the bear ran down the driveway, right? So your sympathetic nervous system, your nervous system that deals with stress, definitely kicks in. Your heart rate increases, your muscle contraction increases. You're going to burn through some more minerals when you're under stress. There's another nervous system called the parasympathetic nervous system, and your parasympathetic nervous system is your relax and repair. So when you are done for the day and you're winding down, you start to feel sleepy, that's your parasympathetic nervous system. Or if you're digesting your dinner, that's your parasympathetic nervous system. It kicks in, it slows things down, it decreases your respiration, it decreases your blood pressure and your heart rate. It tends to slow everything down and allows you to rest and repair. And so when it comes to mental health, many people that are having difficulty, their sympathetic nervous system has been in overdrive, right? They're anxious, their pulse is fast, their blood pressure may be high. They may have digestive issues where their food goes through them too fast, right? So they might have diarrhea, they might have vomiting, they even like twitch, right? Like their legs bounce all the time, or they might even have like a tremor or a shake. Those are physical signs that the nervous system is in overdrive. Maybe it's induced. Maybe someone drank 15 shots of espresso. So at one point, my husband was drinking 15 shots of espresso. He was at Starbucks a lot and he liked his Americano with a lot of shots of caffeine, and his leg would bounce, and he actually started to get like a little bit of a shake, and his heart rate went up and he was anxious and hyper and all that. And we looked at like, hey, how much caffeine are you consuming? Unfortunately, there's a lot of sports drinks that have caffeine. There's bubble water or seltzer water that has caffeine. There's workout drinks that have caffeine. Caffeine is a stimulant, and it's actually monitored by the Olympic Committee, the International Olympic Committee, because it has been shown to improve performance. And so if you're an Olympic athlete, you can have a cup of coffee, not a cup of coffee, or two, but your levels of caffeine have to be at a regulated level. If you have too much caffeine in your body, it is a stimulant and it can make things in your body go faster. And so the International Olympic Committee actually has a limit at how much caffeine an Olympic athlete can be drinking when participating in the Olympics, because it is known to amplify performance, to stimulate the sympathetic nervous system, to make someone more aware. Now, too much caffeine can have the opposite effect. It can make someone feel jittery. It can make someone feel nervous. It can cause cardiac arrhythmias. It can make the heart beat in the irregular fashion. It can cause dehydration. And so someone who is in a high stress mode, having too much caffeine would make that worse. And then they might be diagnosed with anxiety, whereas the natural handling would just be drink less caffeine, consume less caffeine. Remember, chocolate has caffeine and espresso has caffeine as well. Some people don't think with black tea, your sweet tea, your southern tea, your black tea. Black teas also have caffeine, and green tea also has caffeine. And so too much caffeine can make someone feel anxious. So the treatment is not to put them on an anxiety drug. The treatment is to decrease caffeine levels. I'm not saying stop coffee. I'm not saying stop tea. I'm saying decrease consumption of caffeinated beverages, because that could be causing anxiety. Another type of anxiety could be due to parasites. There's parasites in the air we breathe, the water we drink, the food that we eat. And so a higher level of parasites can make someone feel jittery. Ants in your pants can be parasites, right? Like you've heard that kid can't sit still. He's got ants in his pants. Well, actually, he might have ants in his pants. He might have pinworms, and pinworms lay eggs around the anus and can make the anus itchy. And so a child might scratch the anus, scratch around that area, get parasite eggs in their nails, touch surfaces. You touch the surface, wipe your eye, or you touch the surface and bite your nail, and now you have parasites. Or you can get parasites from eating rare meat or sushi, or many other causes. Cleaning out kitty litter, right, can be an exposure of parasites. And so parasites can make a person feel anxious. We just had a new moon last night. Parasites are affected by new moons and full moons. So some people reported they had difficulty sleeping last night or the night before. Maybe they would be diagnosed with insomnia and giving sleeping pills. The sleeping pills will never fix the cause of the problem. You have to find out why the person has difficulty sleeping. Maybe they're watching scary movies before bed. Maybe they're drinking too much caffeine before bed. Maybe they have parasites. And so in the technology that I use called quantum nutrition testing, is we're looking for the cause of somebody's health problems. We don't want to suppress the symptom. We don't want to cover up the symptom. We don't want to cut out the organ or gland. We want to find the cause. And when you find the cause, the symptom goes away and the body rebalances naturally. We're not using medications. We're not using anything that would suppress or damper or decrease the symptom. We're looking for the why. We're looking for the cause. Someone that has a very mental job, they're thinking a lot, they're on the computer a lot, they're crunching numbers, they're reading, they can burn through a lot of B vitamins. B vitamins are needed to be able to think, to be able to process. Someone who's very upset, somebody who's stressed out will burn up, will use more B vitamins. And so there's a vitamin B1 that can help with thinking. Magnesium also can be burned up as far as stress goes. And so lack of magnesium can make tightness. Like if you guys feel your shoulders, can make your shoulders feel tight or your neck feel tight, or even cause spasms or cramps in your back, or spasm and cramps in your calves, or your toe cramp. Or even like sometimes you'll get like your eye will like twitch, your eyelid will twitch. That could be a deficiency of magnesium. And so there's different types of magnesium supplements you can take. Now, some magnesium supplements can also help you if you're constipated. So just know certain magnesium supplements will make you poop, and certain magnesium supplements may not have that laxative effect. Someone who is constipated may not feel very well. I've never had a patient come into my office and say, "Yay, I feel depressed," or "Yay, I'm in pain, I'm happy." Like that would be the wrong emotion when you don't feel well. Most people come in and they're not happy. They feel sad that something's wrong with their body. And oftentimes we get cases where they've been to this doctor, they've been to this specialist, they've been to this special hospital, and they couldn't find a cause. Even myself, I had a time where I felt really dizzy. I had a blockage in my ear, which was part of the problem. I had a vertebrae in my neck, which was part of the problem. But I remember going to a medical doctor and he ran tests and he couldn't find out what was wrong with me. And he's like, well, maybe, doc, it's all in your head. I'm like, excuse me? He was trying to say I was anxious and I needed anxiety pills, or I was depressed and I needed depressed pills. Well, the problem with depression medication is the side effect of depression medication is depression and suicide and aggression. The side effect of anti-anxiety medication is anxiety. So why would you take a pill that causes the same problem that you're trying to get rid of? It doesn't make any sense. I remember I had a guy, he had gout in his big foot and his big toe, his great toe, the big toe. And he went to his medical doctor, and the medical doctor prescribed him a gout medication. And the side effect of the gout medication was a swollen big red toe. And I'm like, oh my gosh, how do you know if it's getting better? How do you know if it's getting worse? And so if someone is not feeling well mentally, do they need more B vitamins? Do they need magnesium? Do they need to replenish electrolytes? So when you're stressed, you can burn up sodium and potassium and trace minerals. So perhaps a good sea salt or a good Celtic salt or a good electrolyte mix can help. People that are stressed sometimes don't eat well. So I remember when I was in the hospital with my father, I was very stressed. And so you go into the hospital cafeteria, which tends to not feed you good food, right? Does not tend to be fresh food or healthy food. And they have like cookies and brownies and chocolate bars and ice cream and all these comfort foods. Well, the problem with eating sugary food is depletes more minerals. It depletes actually your magnesium. It can deplete other minerals that you need. So you're eating this cookie because you want to feel better, right? But then in fact, it makes things worse. The sugar makes things worse. And it just becomes this spiral where the first person feels bad, worse and worse and worse. Now, if somebody is currently on an antidepressant medication, or currently on an anti-anxiety medication, or currently on an ADD or ADHD medication, it would be a very bad idea to stop that medication cold turkey. Those types of medications can have rebound effects where that the person could feel even more depressed. The person could even feel like very, very, very bad. I'm trying not to say certain words that will get this video banned. And so do not do that. I repeat, do not do that. But what we can do is look for, how do we improve things at work? How do we improve things at school? What can we do to decrease your stress levels? I was talking to the academy students today. I said, some of your patients, some of your clients, some of you guys on here do not do anything fun. You work all week. You do things around your house as far as like cleaning laundry and cleaning your floors and scrubbing this and running errands. You do errands all weekend and you never do anything fun. And lack of doing things fun will not make you feel good, right? Watching depressing things or reading depressing things or looking at the newspaper will not help your mood. What will help your mood? Well, any of these nutrients that you're low on, you can take those. Eating healthy. When you're stressed, it is even more important to eat healthy. So a good protein, vegetables, fresh fruit, getting sunshine, going outside when you're depressed, staying inside and binge watching TV, laying on the couch eating crap will not improve your mood. Go outside, go for a walk. Look at the trees, look at the flowers, look at the houses, look at anything, right? Exercise, get your body moving. That will help you improve how you feel. When was the last time you did something fun? Maybe you can plan a trip to the beach or to the lake or to the mountains. And maybe you could go see a friend. Maybe you could do some art. Maybe you can play music. What do you do that is fun? So you can put in the chat, what do you do that's fun? I am a beach girl. I love going to the beach. So in Florida, we have our East Coast beaches closest to us: Daytona Beach, Cocoa Beach, New Smyrna Beach, St. Augustine is on the East Coast, very close to us. On the West Coast, about 2 hours away, we have Clearwater Beach, Madeira Beach. We have Honeymoon Island. We have, trying to think of the other beaches. We have the West Coast beaches, Sanibel's down there, but that's more south. And so, what is fun for you? Do you like to read? Do you like to write? Do you like to journal? Do you like to draw? Do you like to paint? When was the last thing you did that was fun? So, Jonathan likes to do errands. He is super social and loves to go out and meet people. Dr. Maria loves gardening. Other people like to play an instrument. I've always wanted to learn piano. Haven't done that yet. I've always wanted to learn a guitar. Haven't done that yet. Supposedly for chiropractors, playing guitar is not so good for our fingertips, but so there's that. Robin loves the beach and loves Daytona Shores. Very cool. Do you like to roller skate? Do you like to ice skate? What do you like to do? What do you like to do? So if you're listening to this, think about, what do you like to do? My husband and I love to travel. My daughter loves to travel. She loves being in an airplane. She thinks it's the coolest thing ever. I like to take my dog for walks. I like to ride my bicycle. I used to like to play soccer, but I don't play anymore. So what is it? What is it, the thing that gets you excited? And then do it tomorrow. Do it, right? What is the thing that is your favorite thing to do? And when you do those things, it helps to improve your mood. If you have people in your life that suck, if you have people in your life that are like Eeyore, if people in your life that bring you down, don't hang out with them, right? If they're soul suckers, negative Nellies, Eeyore, and I mean like Eeyore from Winnie the Pooh, the donkey that's tail would always fall off, and he's actually colored blue, right? You want to hang out with more like Tigger people, right? People that are happy and enthusiastic and enjoy what they do in life. It doesn't mean you can't have times where you feel sad about something bad happens, there's a loss in your life. It is absolutely normal to have emotion. But if you're getting stuck in an emotion, if you've been labeled with mental health, if you've been labeled with a mental disorder, if you've been labeled with this thing, you don't have to keep that label. These are things that you can do to decrease your symptoms. These are things that you can do to improve your mood naturally. These are things you can do to improve your health. If you need help, I'm Dr. Lisa Palmer, Dr. Mama Bear, and I'd love to help you. Bye, everyone.